Ever feel like your body's trying to tell you something, but you just can't quite figure out how to listen? What if there was like a secret language? You know, one that your body speaks. It's constantly dropping these clues about your health and well-being, like a code. Today we're cracking it. We're diving deep into vital signs. Those key measurements healthcare pros use to check us out. They're like whispers, from the inside, revealing what's going on beneath the surface. We'll find out what they are, how to measure them, and what those numbers really mean. Trust me, there's way more to it than you think. Ready to speak body language? Let's go.
It really is amazing how much we can learn from those numbers. They seem so simple, but, it's like looking right through into how things are working.
Right. So let's start simple. What exactly are vital signs, and why do we care so much?
Vital signs are basically objective measurements. They reflect the status of the body physiologically. They show us life, and they help us figure out how well all those basic functions are doing, like a snapshot of your health right now.
More than just are you alive, it's are you thriving?
Yeah. It tells us about the body's ability to stay balanced, to maintain homeostasis. That's what keeps us healthy.
Why are these signs so important, like in a hospital or at the doctor's office?
They're like the baseline, right? So we can track any changes, see problems early on, and make sure we're treating you right. Think of them as the starting point to figuring out what's happening inside.
So if my heart's racing or I suddenly have a fever, that's bad news.
Yeah, it could be. Vital signs are key in lots of situations, like, for example, when a patient comes into the hospital, or when their health changes, before and after a procedure, or even just for routine checkups.
Wow. So much info from a few measurements. Speaking of which, let's start with something I've always wondered about. Temperature. Why do we have Celsius and Fahrenheit? It's confusing.
I get it. It seems that way. But really, they're just two different ways to measure the same thing. The heat in something, think of temperature like a balancing act between how much heat your body's making and how much it's getting rid of.
So we're constantly generating heat, but also losing it to stay balanced.
Yeah, exactly. And whether we're talking Celsius or Fahrenheit, we're just using different units to talk about that heat.
Now, what about core temperature and surface temperature? What's the difference?
Good question. Core temperature is the temperature of your insides, mostly your organs in your chest, your belly, and your head. It's really controlled and stays pretty much the same. Surface temperature, that's your skin. It changes all the time depending on where you are, the weather, all that.
So that's why someone's hand might feel cold, even if they say they feel warm.
Exactly. You're feeling their surface temperature, and that's all about what's going on outside.
Interesting.
Mm.
What's considered a normal temperature, though?
A normal core body temperature is usually between 36.5 and 37.5 degrees Celsius. That's 97.8 to 99.6 Fahrenheit. But that's just the average. Everyone's a little different. Age, time of day, if you've been working out, all of that plays a part.
So around 37 Celsius, or a little under 99 Fahrenheit, give or take.
Right. And then there are the dangerous points. Hyperpyrexia, that's a really high fever. And hypothermia, that's when your body temp gets dangerously low. Both can be life-threatening.
Definitely serious. And a fever is usually a sign something's wrong. Are there different types of fevers?
There are. We classify them based on the pattern. So, for example, you can have what's called intermittent fever. That's when you go back and forth between fever and normal temperature, or even below normal. Remittent fever, the temperature changes more over a day. Relapsing fever is short fever periods than normal for days. And constant fever, that's when the temperature stays high. It might fluctuate a little, but it's always above normal.
A fever fingerprint. That's a lot of variations. And so many things can affect our temperature besides being sick.
Absolutely. Age, hormones, time of day, if you've been exercising, stress, even the environment.
It's complicated. So when we're measuring temperature, what are the most common spots?
Usually it's oral, in the mouth, rectal,
Yeah.
axillary, under the arm, and tympanic, which is in the ear.
Which one's the most accurate? I feel like they always get different numbers depending on where they take it.
Rectal temperature is usually the most accurate because it's closest to that core body temperature we talked about, but it's not always the easiest or the most comfortable, so we often use other sites too. It depends.
Right. I always forget they say no hot or cold drinks before an oral temp.
Yeah, because that can change things. Accurate measurements are important.
All about the details.
Yeah.
Okay, on to pulse. This one always gets me because it's literally a wave of blood traveling through your arteries.
That's a great way to think about it. The pulse is that pressure wave that we feel every time the heart beats. It's pushing the blood through your system. It's directly connected to your heartbeat, controlled by the autonomic nervous system.
It's like a constant rhythm inside of us. How do you check someone's pulse?
We palpate, which means feeling it with our fingers, or we auscultate, which means listening with a stethoscope.
So feeling at the wrist is palpation, and listening to the heart is auscultation.
Right. And we've got two main types of pulse. Peripheral, that's what we feel in the arms, legs, neck, anywhere an artery is close to the skin. And apical, that's taken right at the heart, and we use it for babies because their peripheral pulses can be hard to find.
Like a map of your circulatory system, with different spots to check in.
I like that.
When you're checking someone's pulse, what are you looking for?
Three things: rate, rhythm, and volume. Rate is how fast the heart's beating, beats per minute. A normal resting pulse is somewhere between 60 and 100 beats per minute for an adult. Faster than that is tachycardia, and slower is bradycardia.
I've heard those terms. Rhythm, that's about the regularity of the heartbeat, right?
Yeah. Are the beats even, or is there a pattern?
And that volume.
That's how strong the beat is. It tells us how well the heart is pumping. A strong pulse feels full. A weak pulse could mean there's not enough blood flow.
It's not just speed, it's power, too.
Exactly. We look at things that can change the pulse. Age, what sex you are, your autonomic nervous system.
Makes sense. Our bodies are always responding to everything. Exercise changes your heart rate, but what else affects it?
Oh, tons of things. Temperature, fever, are you stressed out? Even what position you're in and what medications you're on. Even holding your breath can change your heart rate for a minute.
So many things. It's
Yeah.
always adjusting. Where do we find these pulse points? I know the wrist is one,
That's the radial pulse, easiest to find.
right?
But we have the carotid pulse, that's on the side of your neck, below the ear. Be careful checking that one. Too much pressure, and you can slow the heart down by accident.
Noted. Where else?
There's the temporal pulse at your temple, brachial pulse inside of your elbow, femoral in the groin area, popliteal behind the knee, posterior tibial on the inside of your ankle, and pedal on the top of your foot.
Wow, that's a lot. I
Mm.
remember learning a trick for counting. If it's regular, you only have to count for 30 seconds and multiply by 2. But if it's irregular, you have to do the whole minute.
Yeah, that's a good tip. And it's important to be accurate, especially if it's irregular.
It feels like forever when you're counting each beat. You mentioned listening to the heart, too. What's that all about?
When we listen to the apical heart sound, we're listening for the lub-dub. Those sounds are from the valves closing. S1, the lub, is the mitral and tricuspid valves. They're between the atria and the ventricles. S2, the dub, that's when the pulmonic and aortic valves close at the end of systole.
Each lub-dub is one heartbeat.
Exactly. If we hear anything weird, like a murmur, it could mean there's a problem.
It's like the heart is talking to us. Okay, let's move on. Respiration. Breathing seems pretty simple, in and out, but I bet there's more to it.
You'd be right. Respiration is the whole process of how we get oxygen in and carbon dioxide out. Ventilation, that's just the air moving, just one part of it.
So respiration is the big picture, ventilation is one of the players.
Exactly. Important to know the difference.
I see. What about terms like hyperventilation and apnea?
Those describe breathing patterns. Hyperventilation, that's breathing too fast and too deep. You're getting more oxygen than you need. Hypoventilation is shallow breathing, not enough oxygen. Yupnea, that's normal breathing, nice and easy. Bradypnea, that's too slow. Tachypnea, that's too fast. And apnea, that's when you stop breathing. That's definitely a problem.
So many ways to breathe. Like pulse, are there things that can affect breathing rate?
Tons. How old are you? Male or female? Where are you? Like how high up? Exercise, fever, stress, meds. Even your emotions. If you're anxious, you breathe faster. Relaxed, you breathe slower.
Another mind-body connection. I learned a trick for assessing respiration. Pretend you're taking their pulse, but actually count the breaths.
That's a classic. They don't even know you're doing it, so they breathe naturally.
Sneaky. And like with pulse, we check the rate and the rhythm. 30 seconds if it's regular, full minute if it's not.
Right. And how deep are they breathing? Shallow, deep, struggling. It all matters.
You can tell so much just from watching someone breathe. Did you know babies breathe way faster than adults? Like 60 times a minute?
It's amazing, right? Tiny lungs, working hard. The human body is so cool.
It really is. Okay, on to the big one. Blood pressure. It's important, but what is it exactly?
Blood pressure is the force of the blood pushing against the walls of your arteries as it moves through your body. Think of your arteries like a highway system, and your blood is the traffic. Blood pressure is how hard that traffic is pushing against the walls of the highway.
Okay, I can picture that. We measure it in millimeters of mercury, mmHg, right?
That's right. We use a sphygmomanometer, which is a fancy word for the blood pressure cuff, and a stethoscope to listen to the blood flow. There are two numbers we record. systolic and diastolic pressure.
The top and bottom numbers, right? I always mix those up.
It happens. Systolic, that's the top number, is the highest pressure when your heart beats and pushes the blood out.
Hmm.
Diastolic, the bottom number, is the lowest pressure when your heart relaxes between beats. Systolic is the peak of the wave. Diastolic is the trough.
Okay, I'm getting. So the difference between the two is called the pulse pressure.
Right. And we use all three, systolic, diastolic, and pulse pressure, to understand how your heart and blood vessels are working.
Like a puzzle. Each piece tells part of the story. What about things like hypertension and hypotension? What makes blood pressure change?
Well, just like temperature and pulse, lots of things can affect it. How old are you? Do you have a fever? Are you stressed? Even bleeding can have a big effect. Day-to-day stuff, meds, exercise, how much you weigh, smoking.
Another reminder to take care of ourselves. Where do you measure blood pressure? I know it's usually the upper arm, but I've seen them do it other places too.
Upper arm, using the brachial artery, that's the most common spot. But we can also use the thigh, the popliteal artery is there, the forearm, the radial artery, or even the leg, using either the posterior tibial or dorsalis pedis arteries. Depends on the patient.
Good to have options. Let's talk about hypertension and hypotension. High and low blood pressure, right?
Basically. But it's a little more than that. Hypertension is when your blood pressure is high all the time, not just a one-time thing. Same with hypotension. It's consistently low. One high or low reading doesn't mean anything for sure.
So one bad reading doesn't mean I'm doomed.
Nope. Lots of reasons why it might be off temporarily. And with hypertension, there are different types. Secondary hypertension, that's when we know what's causing it, like a kidney problem, hormones, or certain medications. Then there's primary hypertension. We also call it essential hypertension. That's when we don't know what's causing it.
That sounds tricky. How do you actually measure blood pressure? I know there's the cuff and the stethoscope, but what's the process?
We use a sphygmomanometer, that's the cuff, and the stethoscope is for listening as we let the air out of the cuff.
Take me through it step by step.
First things first, we have to explain what we're doing to the patient and make sure they're comfortable. If they're anxious, it can mess up the reading.
Setting the mood is important.
Exactly. We'll make sure there's no tight clothing on their arm. That can affect the reading too. And we need to know if they've had caffeine or smoked in the last 30 minutes. Those can make the blood pressure go up.
That's why they ask about the coffee.
Right. Then we position them. They can lay down, sit, or stand as long as their arm is supported at heart level with their palm up. Consistency is key.
Position matters too.
Every little thing can make a difference. You know, before we get too into the details, I wanted to mention a really awesome organization that helped us put this whole deep dive together. They've been amazing to work with.
Huge thanks to London Heartbeat's Z Academy in the UK. They offer over 140 healthcare courses. If you're interested in this stuff, you should check them out.
They're top-notch. Really know their stuff.
Absolutely. To all our listeners, if this is interesting to you, head over to their website. Tons of great info and courses.
And they're on social media too. Facebook, Instagram, Spotify, and YouTube.
Right. Make sure you subscribe so you don't miss out on future discussions like this one. Okay, back to blood pressure. How do you actually take the measurement?
So we've got our patient comfortable, positioned right. We wrap the cuff snugly around their upper arm, about an inch above the bend in their elbow.
And I know cuff size is important.
It's critical. Too small, and the reading will be high. Too big, and it'll be low. The bladder inside should go around at least 80% of their arm.
No one size fits all then.
Nope. Okay, so cuff is on. We feel for the radial pulse at the wrist, and we inflate the cuff until we can't feel it anymore. That gives us an idea of their systolic pressure. Then we pump it up about 30 mmHg more.
Why higher?
That way we block the blood flow completely. Then we can really hear when it comes back as we let the air out.
Okay, so then you listen with a stethoscope.
Yeah, we put the stethoscope on the brachial artery just below the cuff and slowly let the air out. About 2 to 4 millimeters of mercury per second, we're listening for the blood flow. As the pressure drops, blood starts flowing again, makes a sound. The first clear tapping sound, that's the systolic pressure.
The top number. How do you get the diastolic?
We keep letting the air out, and that tapping sound changes. It gets muffled, then goes away. When it's gone, that's the diastolic pressure, the bottom number.
So systolic is when you first hear it. Diastolic is when it disappears?
Yep. Once we have both numbers, we deflate the cuff all the way and take it off.
And write it all down.
Of course. Systolic and diastolic pressure, the date and time, and what position the patient was in. We have to be really careful with the records.
So you can compare later. What happens if you see a big change from the last time?
Then we tell the doctor or nurse. They'll figure out what's going on and if anything needs to be done. We're just gathering info.
Teamwork. Ready for vital sign number 5.
Hit me with it.
Oxygen saturation. This one's become so important. What is it exactly?
Oxygen saturation, we call it SpO2 sometimes. It measures how much of the hemoglobin in your blood is carrying oxygen. Hemoglobin is a protein in red blood cells. It takes the oxygen from your lungs to the rest of your body. So SpO2 tells us how well that's working.
How well our body is using the oxygen we breathe in.
Yes. A normal reading is 95 to 100%, anything lower than 90%, and that's called hypoxemia. Not enough oxygen in the blood.
How do you measure that? Is it complicated?
Easy peasy. We use a pulse oximeter. It's a little clip, usually goes on your finger or earlobe.
I've seen those. They have a little red light.
Right. It uses light to measure the oxygen. Oxygenated blood and deoxygenated blood absorb light differently, so the pulse oximeter can calculate the SpO2 level based on that.
That's really cool. So easy to get important info. Anything that can mess up the readings.
A few things. If your hands or feet are cold, it can throw it off. Swelling, edema, that can interfere too. Even nail polish, especially dark colors.
Good to know. What happens if your oxygen saturation is too low?
If it drops below 85%, that can be bad news for your organs, especially the brain. You can get confused, dizzy, short of breath, even organ damage if it stays low for too long.
Wow. Definitely a vital sign.
For sure. Gotta catch it early.
This has been an incredible journey. We've covered so much. Temperature, pulse, respiration, blood pressure, and oxygen saturation. It's wild how much we can learn from those simple measurements.
It's a secret code. Once you know how to read it, it tells you all about the body.
And speaking of learning, another shout out to London Heartbeat Seed Academy for their help with this deep dive.
They've been fantastic.
If you want to keep learning, check out their website. They have over 140 healthcare courses, from basic stuff to more specialized things like heart care and breathing problems.
Something for everyone, from beginners to pros.
And don't forget social media. They're on Facebook, Instagram, Spotify, and YouTube. Always posting cool stuff. Make sure you subscribe.
Stay in the loop.
Okay, so that was part one of our deep dive. We talk about temperature, pulse, respiration, blood pressure, and oxygen saturation. What they are, how to measure them, and what can go wrong. But there's still more to learn.
We've just scratched the surface. Next time we'll go deeper. Talk about what can affect these measurements, what it means when they're off, and how all this is used in healthcare. Stay tuned. Welcome back. Before the break, we were talking about oxygen saturation and how important it is.
Yeah, how a little device, a pulse oximeter, can tell us if we're getting enough oxygen to all our parts.
Amazing technology, right? But it's important to remember one reading doesn't tell you everything. Got to look at the big picture.
Right, the context. So what can make those vital signs go up or down, besides just being sick?
Well, age is a big one. As we get older, our bodies change. And that shows up in our vitals. Like, for example, older adults often have a slower heart rate, and their blood pressure might be a little higher.
Our bodies are always changing, adapting.
Exactly. And any health problems you have, those matter too. Someone with a heart condition might have a faster heart rate, or an irregular rhythm. Someone with breathing issues might have a faster breathing rate or lower oxygen levels.
So everyone has their own normal, and if things change, that tells us something.
Exactly. And medications play a role too. Some meds, like beta blockers, they're for high blood pressure, can slow down your heart rate. Other meds might raise blood pressure or change your breathing. It's all connected.
Like a big puzzle, all these factors can affect the measurements.
That's why it's so important to have a trained professional looking at them. They can put it all together. Your history, your health now, all of that matters.
It's not just numbers, it's the story behind the numbers. What are some red flags? When should we be worried?
High fever is never good, especially with chills, a headache, or muscle aches. Could be an infection or something else serious.
What about heart rate? When is that a problem?
Really fast heart rate, if it doesn't slow down, that could mean something's wrong with your heart. Or maybe an electrolyte imbalance. Or you're really dehydrated. Really slow heart rate, especially with dizziness or feeling tired, that's not good either.
Makes sense. Breathing?
If you're working hard to breathe, wheezing, or you're short of breath, especially if it comes on suddenly, that could be a big problem. You need help right away. Blue lips or fingertips, that's cyanosis. That means your blood's not getting enough oxygen.
Those sound scary.
Yeah,
It's a reminder that these numbers can tell us about serious problems.
absolutely. Listen to your body. If something feels off, get it checked out.
Speaking of taking care of ourselves, let's talk about London Heartbeat Z Academy again. They've been a big help with this episode.
They're really dedicated to healthcare education. It's great.
Yeah, they have over 140 courses, everything from basic life support to advanced cardiac care. If you're thinking about a career in healthcare or just want to learn more about staying healthy, you should check them out.
Courses for all levels, from newbies to the pros. And they're always updating their stuff, staying current.
And don't forget about their social media: Facebook, Instagram, Spotify, and YouTube.
Good way to stay up to date on all things health.
Okay, so we talked about what vital signs are, how to measure them, and when to worry. But how are they actually used by doctors and nurses?
One of the most important things is to get that baseline we talked about. When you first see a patient, you take their vitals to see what's normal for them. Then you can compare and see if anything changes.
Like a starting point for their healthcare.
Exactly. And as you see them over time, you can spot those little changes that might mean something's starting to go wrong.
Like a detective looking for clues in the numbers.
That's a good way to put it. Like if someone's blood pressure is creeping up over a few visits, that could be the start of hypertension.
Catch it early.
Exactly. Vitals are also super important during procedures, and someone's recovering from surgery or an illness, we watch their heart rate, their breathing, blood pressure, oxygen levels. That way we can catch any problems right away.
A safety net.
You got it. And in an emergency, vitals are the first thing we check. They tell us how serious things are and what we need to do right away.
Life-saving information from just a few measurements.
Absolutely. They're essential for anyone working in healthcare, and it's not just hospitals and clinics. You see it in long-term care, home health care, even sports medicine to keep track of how athletes are doing.
Important for everyone, really.
No matter how old you are or where you are, vitals are key to understanding and managing health.
This has been a fascinating look at vital signs. We've covered a lot. What they are, how they're measured, what can go wrong, and how they're used by healthcare providers.
It's just the beginning, though. There's always more to learn about these important signs of how our bodies are doing.
And a final thank you to London Heartbeat's Zed Academy for their help with this episode. They really are dedicated to making healthcare education accessible to everyone. If you're interested in learning more, I highly recommend checking out their website and their social media.
They're a great resource, always sharing useful information and keeping people up to date on what's happening in healthcare.
Okay, we've learned a lot about vital signs. But what if we could actually use this knowledge to take better care of ourselves? Pay attention to those little changes and make adjustments to our lifestyle, our habits, even our thoughts to optimize our well-being. It's something to think about as we continue to explore the world of health and wellness.
It's fascinating to think about, isn't it? The power we have to influence our own health by understanding our bodies and making conscious choices.
Until next time, stay curious and keep exploring. It's really amazing to think about. All that information packed into those 5 measurements: temperature, pulse, respiration, blood pressure, oxygen saturation.
Like puzzle pieces, right? Put them all together, you see what's going on inside.
Yeah. And if we understand what we're seeing, we can actually be part of our own healthcare.
Exactly. Talk to your doctor, ask questions, really understand what's going on.
It's not just listening to the doctor, it's being part of the team.
Right, you're in charge of your own health.
We talked before about how vital signs change as we get older. What are some of the big differences?
Well, as we age, lots of things change naturally, and that shows up in the measurements, like heart rate. It tends to slow down over time. So a heart rate that would be normal for a younger person might actually be too slow for an older person.
The normal range changes as we age.
Exactly. And it's not just heart rate. Blood vessels, they get stiffer as we get older. That's one of the reasons blood pressure goes up. Hypertension is more common in older folks.
It's like our bodies are telling a story.
They are. And if we pay attention, we can learn a lot. Make good choices, take care of ourselves.
Speaking of good choices, what can we do to keep our hearts healthy and keep those vital signs looking good?
Exercise. So important. Get that heart pumping, improve your circulation, bring down that blood pressure. Even just walking or swimming can make a big difference.
You got to move those bodies.
For sure. And eat right. Lots of fruits and veggies, whole grains, lean protein. All that helps keep your blood pressure down, lowers cholesterol. Good for the whole system.
So all that healthy living stuff they tell us about, it really does matter.
It does. And don't forget about stress. All that stress, day after day, it can raise your blood pressure and cause all kinds of problems. Find healthy ways to de-stress, meditation, yoga, spend time in nature.
Mind and body, got to keep them both in balance.
Right. And of course, no smoking and not too much alcohol. Those are biggies for heart health.
Choices, it all adds up.
It does. Our bodies are amazing, but they're also sensitive. Everything we do, from what we eat to how much we sleep, it all affects our vital signs and our health.
We have more control than we think.
We do. Make good choices, take care of yourself, and your body will thank you.
This has been a really cool deep dive. We've learned so much about vital signs, what they are, how to measure them, what they can tell us, and how they're used in healthcare.
And we talked about why it's important to know your own normal ranges and what to do if something seems off.
Big thanks to London Heartbeat Z Academy for helping us put this together. They're an amazing resource if you want to learn more about health and healthcare. Check out their website for all kinds of courses.
They really are the best. So dedicated to educating people, it's inspiring.
And they're all over social media, too.
Yeah.
Facebook, Instagram, Spotify, and YouTube. Give them a follow. You won't regret it.
So much good stuff. Stay connected. Stay informed.
As we wrap things up here, I want to leave you with something to think about. We've talked about how vital signs are like a window into our physical health. But what if we could tune in even more? Really listen to those whispers our bodies are telling us. Could we use that knowledge to live even